So I think at the start, when we were only just becoming aware that COVID was here, on home ground, I did have a personal experience where often we provide cover in the accident and emergency department where we review patients who've been sent up by general practitioners for assessment to hospital. And we had a designated area in the emergency department, and that had now become the area where we were going to review suspect cases of COVID. So initially, there was no official stance on having to wear PPE. And so I encouraged my junior doctors to make sure that they had scrubs on for work, which is not something that we normally do in our specialty. And I remember going to a meeting in scrubs, and we were talking about the provision of scrubs for our trainees and for ourselves as a consultant body. And we were told that we had to be mindful and be positive role models to make sure we weren't taking scrubs away from theatre staff or intensive care or anaesthetics. Yet we were also expected to be on the front line assessing people with suspected COVID. So in the end, I think as a group of physicians, we decided that we would buy our own scrubs. So that was something at the beginning that just felt like, there was no acknowledgement or care in terms of making sure we were safe. So we've all bought our own scrubs. And I remember going to buy them and having a laugh because the person at Hewitt said to me, "Do you think you'll get reimbursed?" And I laughed out loud and I said, I very much doubt that. And as time has gone on, I don't think in fact, I think we've gone the other way with making sure now that people have, the basic PPE in the clinical work areas. And I haven't experienced any medical equipment shortages, to be honest.